Hello and welcome to today's presentation on meaningful use tips, tricks, and things to know. You might have noticed the phone lines have been muted as we're recording today's event, and we will be distributing the recording as well as the presentation slides after the event to all registrants. If you have questions during the event or after, you can submit them using the questions section on your GoToWebinar panel. To get there, you just click the orange arrow in your GoToWebinar panel to expand and type in submit your questions in the questions section. We'll try to get to as many as we can at the end of the presentation, but if we can't get to yours, we'll go ahead and answer you offline as well. To take a quick look at the agenda, today we're going to cover meaningful use, what is meaningful use, important meaningful use dates and deadlines, what are your MU options, tips and tricks for navigating through meaningful use, and we also have a special offer for our participants. To tell you a little bit about the company before we get started, who is UpDoc? So we are the leading physician connectivity platform. We currently have more than 45 EHR vendors, which represent 140,000 physicians who have selected us to provide direct, secure messaging and their patient portal to meet the meaningful use requirements. As a company, we try to help independent physicians, medical practices, and hospitals spend less time on administrative work, better engage their patients, improve revenue, overall delivering better care to their patients and helping you remain independent. Our presenter today is Connie Patterson. She is the Director of Project Management for UpDocs and our local guru on meaningful use. She has a vast knowledge of meaningful use with more than 20 years experience in systems management, QA, business analysis, and project management. I'm going to go ahead and pass it off to Connie.
Thank you, Katie. Well, to get started, let's go to a basic question. What is meaningful use? It's basically about improving health care through the adoption and use of electronic health records, improving patient safety, improving patient outcomes, improving privacy and security, and eventually reducing healthcare costs. So what drives meaningful use? Monetary incentives for participating in the program, Medicare payment reductions for MDs and hospitals who choose not to participate or meet the requirements. And there's also a shift in the reimbursement model in the works. We're going to go away from pay for service to pay for quality. Now, we'll be using several acronyms throughout the presentation, so let's just do a quick review. CMS, Centers for Medicare and Medicaid Services, EHR, Electronic Health Record, EH and EP, eligible hospital, eligible provider, dealing with meaningful use. HIT is Health Information Technology, MU for meaningful use, and TOC for transition of care, often called referrals. Now let's talk about the deadlines for this year in 2014. They do vary if you're a provider or a hospital, and if you're participating in the meaningful use Medicare or the Medicaid program. 2014 is a special year. All participants need to meet the requirements for 90 days, unless you're in the first year of Medicaid. So under Medicare, a provider has to report on a calendar quarter, and the last date to begin for 2014 is October 1st. Now, a hospital under Medicare reports under the federal fiscal year, so their last date to begin was July 1st. Conversely, under the Medicaid program, it's any continuous 90 days unless the state specifies otherwise. So for providers, the last day to begin is October 3rd, and for hospitals, the last possible date to begin was July 3rd. Now let's talk about your options for meeting meaningful use in 2014. You do have some different approaches you can do. So the first approach is use a 2014 certified health information technology. And this is your EHR and any other sub components necessary to qualify you for meaningful use. This enables you to earn the incentive, to avoid payment reductions for MD services paid by Medicare, and meaningfully use for 90 days. This prepares you for 2015, which come January, you do have to do full year reporting and meet all the requirements for that whole period. We consider this the best option. Your second option is to use 2011 certified HIT. And this is based off of a recent federal proposed rule. So if it gets adopted, this is an option, and more than likely it will. It will still allow you to earn the incentive even though you're using an older certified system. It will allow you to avoid the payment reduction. With this option, you also need to meaningfully use for 90 days. When it comes time to do your meaningful use attestation, you'll need to specify that you could not implement the 2014 HIT in time, and that's something that they'll be adding to those attestation screens. This option is not available to anyone in the first year of Medicaid, which is considered the Adopt, Upgrade, Implement year. And it doesn't prepare you for 2015, which requires that full year reporting using a 2014 certified EHR. So this option really only buys you 3 months. So if you choose this option because that's the absolutely last resort you can do to meet it, just make sure you keep the momentum up to get ready for the 2014 EHR systems. So I would give this one option a letter C-. Your third option is to do nothing. You'll get no incentive money, and you'll get payment reductions for MD services paid by Medicare. And just to clarify a little bit of that, some people confuse this payment reduction with a reduction in the incentive money. It's not. It's a reduction in the services that you bill to Medicare. It does only apply to MDs, and you won't see it hit your pocketbook for 2 years. So for 2014, all the services you provide this year, if you don't meet the criteria, comes off of your payments in 2016. Now, the rest of today's presentation is going to be specific to the patient portal and messaging related criteria for meaningful use. Those are view, download, and transmit, just basically the portal, secure electronic messaging, clinical summaries to the patient after each office visit, outgoing transitions in care, and this is sending a care summary, incoming transition in care, which is receiving a care summary. So now we'll dive into the details of each of those. So the first one is the patient portal. This is at view, download, and transmit. It applies to both eligible providers and eligible hospitals. The requirement is to provide patients the ability to view online, download, and transmit their health information within 4 days of the information being available to the provider. This was available under Meaningful Use Stage 1 as a menu item that you could have chosen, but under Meaningful Use Stage 2, this is core, meaning that it is required. Now, to meet the requirement for EMU2, more than 50% of your patients seen by the EP or for the hospital that are discharged were given access. This basically means you've given them a user ID and password to get to the portal. And there's a second part. More than 5% of these patients actually did access, meaning that they logged in and saw their information. Let's talk about the benefits of a patient portal. Patients can view, save, and print their medical information without having to call or go into the office. They can easily transmit their information on to other providers or caregivers. It helps them to better understand their health conditions and more likely adhere to their treatment plans. And they can access this information at any time, day or night. Let's talk a little bit more about transmitting from the portal. And this, again, is within the patient's control, and they can send this on to anyone else, typically a healthcare entity. And there is an additional requirement associated with transmitting. It has to be transmitted using a standard referred to as direct messaging. And this is kind of new for Meaningful Use Stage 2, but will be growing quite a bit in its use. So next question, what is direct messaging? It's a way to securely send health information over the internet. Similar to email, but considerably more secure. It can be used to transmit many types of documents, but for meaningful use too, the focus is on transmitting summaries of care. A direct message address looks very similar to an email address, but generally includes the word direct. You cannot use a direct address in your regular email software like Microsoft Outlook. It's for use in your EHR or other direct messaging software. EHR systems then import the information sent via direct message into the patient's records. So let's talk about some tips and tricks related to the portal. First up is, how do we advertise? Put up posters in the waiting and exam rooms. Hand out flyers about the portal, or you could even mail them. Wear a button to encourage questions. Ask me about the portal. Add your portal web address to your appointment cards, your business cards, letterhead, and your company website. Want to train your staff on the use and benefits of the portal. They're your best cheerleaders. Front desk, make the portal registration just part of the normal check-in or check-out process. Tout the benefits of the portal to get the patients excited. And encourage patients to send messages through the portal instead of calling, and periodically remind them that the portal is available to them. Also engage the clinical staff. Encourage doctors and nurses to discuss the portal with the patient during appointment. Now, I know time is always really tight for appointments these days, but if you could just take about 60 seconds to bring it up. Also prepare a handout with quick and easy to understand instructions for using the portal. Create a portal authorization form for patients to grant access to caregivers. Your daughter or son may help an elderly parent with their health care, but that parent has to grant access for that daughter or son to see that information. Before giving a patient or even a caregiver access to the portal, be sure to check their photo ID. You want to treat this information as highly secure. And you want to collect their email address. Most portal applications require an email address for the patient. Next is send a summary of care to the patient's portal after each office visit, and you're required to do that within 1 business day. And for hospitals, you have to send it within 36 hours of that discharge. Keep in mind, it doesn't need to be the actual provider who sends the information to the portal. It can be any authorized person. Our next meaningful use requirement is secure messaging, and this applies only to eligible providers. The requirement is to use secure electronic messaging to communicate with patients on relevant health information. So this is a two-way conversation. Under stage 1, this isn't applicable because it's brand new with stage 2, and it came in as a core item, meaning it is required. And you meet the requirement if more than 5% of the patients seen by the EP sent a message to the provider. So again, this is putting control into the patient's hands. The patient has to send to the provider. Now, an EHR vendor can implement secure messaging in several different ways, but the most common is through the patient portal. The patient would use the portal to send and receive, whereas the provider uses the EHR to send and receive. So let's talk about some tips and tricks regarding secure messaging. The biggest one is to do a quick demo of the portal to the patient and have them send the provider a message during the demo. This right off the bat qualifies you for your meaningful use incentive because the patient has sent that message. You can also send the patient a message that they need to respond to, something like an open-ended question. Put a computer in your waiting room for patients to use while they wait. Not that we ever have to wait for doctor's appointments, of course. Set time aside each day to review messages from the patient. I know this is probably one of the most controversial, is how do doctors and other providers find the time? But this is very important to engage the patients into their care. The next requirement is talking about an office visit summary. The requirement is to provide a clinical summary to the patient after each office visit. This was core under stage 1 and still core under stage 2. You meet the requirements if more than 50% of the patients seen by the provider receive a summary within 1 business day of the visit. So let's talk some tips and tricks. There are multiple ways to provide the patient with a summary. The easiest and best way to do it is through the patient portal. If the patient has access, they can immediately pull down the information, as long as you make sure you send it to the portal. You could print out a summary when they check out, which of course that means you have to enter your information in during that appointment, so it is available at checkout. You could mail them a summary, which increases postage costs. But it's very important to get that information into the EHR on that same day. You have only 1 business day after the visit to provide the info. Our next MU requirement is the summary of care outgoing. This applies to both providers and hospitals. The requirement is to provide a summary of care for each outgoing transition in care to an external party. Now, a transition in care usually means you're sending the patient to the hospital or to a specialist or some other provider outside of your organization. But there is a little twist here that we'll talk about in a minute. Under stage 1, this was a menu item. Under stage 2, it's core. You meet the requirement if more than 50% of the transitions of care included a summary of care, and more than 10% of those were delivered via direct messaging, meaning it was sent electronically, and at least 1 summary was sent via direct messaging to a provider using a different EHR vendor. Now they do have an alternative to prove this part of the measure, and CMS has a website called the EHR randomizer that will let you do a single test to also meet that. So for outgoing transitions in care, there are 3 parts of the measure that you have to meet. Next requirement is the opposite. It's the incoming transition in care. Applies also to providers and hospitals. So obviously, in addition to sending, you have to be able to receive and then import those summaries into your system. And that transport method is also direct messaging. The good news is you're not measured on this for MU2, but you do have to be able to do it. Let's talk about the benefits. It supplies the receiving provider with key health information, which can be very important in a critical emergency type situation. Gives quicker and more accurate way to transfer the information into the receiving provider's EHR. Reduces costs of reproducing or transporting paper records. Improves the quality of care through more complete and timely information. And provides patients with an accurate, readable record. Tips and tricks. You can use various methods for delivering the summary of care. Send the report with the patient. Mail it. Fax it. Send via direct messaging. And obviously this is the preferred method. That's what gets it there the quickest and most secure. Be sure you understand how outgoing transitions of care need to be recorded in your EHR system to ensure they count toward your meaningful use statistics. Either review the documentation or ask your software vendor. We've seen a lot of variations in how EHRs handle this. When you're sending information to another provider, make sure you get that patient's release to disclose that information. As with the office visit summary, be sure to enter the information as soon as possible. You do have up to 4 business days, but why put off till tomorrow what you can do today? The 4 business days is so you can get lab results and things back in a little quicker. And as with the office visit summary, it doesn't have to be the provider who prepares or sends the summary. Any authorized person can. So what if you don't have another provider or hospital you can send to? Maybe they're not ready for direct messaging. Well, per a recent FAQ from CMS, you can send the summary to another provider who has access to your EHR. Now, previously, this wasn't allowed, because since they have access, they can simply look it up. But this new FAQ kind of lessens the rules a bit to allow you to qualify easier. So say you have a home health or hospice that's part of your organization. And maybe they can still access online, or you can still electronically send them the summary of care and count that. But you do have to be consistent. Instead of sometimes letting them look it up and sometimes sending it, you would always have to send them the summary of care. So what if you don't do outgoing referrals? No worries, it doesn't count against you. You can simply declare an exclusion from the requirement.
I thought you were worrying about time.
So, dealing with the direct address. To get that more well known, add your direct address to your business card or to your website. So how do you get another provider's address? Well, obviously, if they did the same, you could check their business card or website. But the simplest, the same as you did with email. Just ask them. Now, similar to telephone white pages, there will soon be a provider directory that's available online within your EHR or other direct messaging software that will let you search for a provider and get their direct address. Now, there are many ways to use direct messaging beyond meaningful use, and here are just a few ideas. Insurance claims, often you need to supply supporting documentation. You could send that via direct messaging. You could have other requesting parties, like a law firm that need copies of medical records. You could send that electronically. You could use it to send brochures and other educational materials to the patients. And I'm sure you can think of several more ways that would either be a benefit to you or your practice and to your patients. So that's it for Meaningful Use Stage 2. So let's talk a little bit about Meaningful Use Stage 3. There's going to be an increased focus on electronic health information exchange, which is most of what we've been talking about today, and also using that information to improve care. Details are still under construction, and the proposed start date is January 1st, 2017 if you're a provider, and October 1st, 2016 if you're a hospital. So I'm going to turn it back over to Katie, and she's going to go over the information beyond meaningful use.
Thank you so much, Connie. That was a great overview of some of the meaningful use metrics as well as tips to kind of help get you there. Before we do go into questions, I wanted to take a quick moment to talk about going beyond meaningful use. So you've been pushed to put this kind of core solution in place by the legislation, and I wanted to talk about how you can leverage that, what seemed kind of like a burden in the beginning, into an opportunity to improve your workflow, maybe better engage your patients, and ultimately deliver better care. And I wanted to show you just a little bit about some of the solutions UpDocs has developed to help practices go beyond meaningful use. So we do offer a patient portal as a full-service patient engagement solution. So the secure messaging and clinical summaries Connie mentioned are certainly included. We've also thought through adding electronic forms, scheduling, online bill pay, automated appointment reminders, just as tools to kind of drive patients to the portal, because as you get the portal implemented at your practice, your next goal will be getting as many patients as possible engaged on that portal to hit those requirements. We also provide direct email for practices, as she's mentioned, and then we offer integrated electronic faxing as well. So kind of the benefit of using our portal and the electronic faxing together is that we're able to consolidate all of your communications, be it with patients or with other practices, into one universal inbox. So it's kind of one-stop shopping for your communications. These services are available either directly to physicians or through your EHR providers if we're partnered with them. And we do have a special offer on them today. So we always offer a 15-day free trial to all new customers. But as a special offer for registrants today, we're going to go ahead and extend that to 30 days so you can really see the value of the service. So to take advantage of that offer, when you register on our website at www.updocs.com, go ahead and use the promo code SUMMER, and we'll go ahead and extend that to a 30-day trial rather than the 15. If you wanted more information before signing up for that free trial, you can visit our website at updocs.com. You'll be able to request web demonstrations there. You could also email us at info@updocs.com or call us directly, and we're happy to answer those questions ahead of time. And now Connie's going to take a quick look through your questions and see if she can get through a few. These are actually really great questions, a little bit more detail oriented, so it might take a quick moment to kind of sift through.
Okay, our first question is, do I just put the address into a compose window? And that is correct. If you're using the UpDocs inbox, there is a compose window, and you have two areas. One is to send to a patient, the other one's to send to a contact. So if you're sending it to another provider, you would put in that direct address into that send to contact and type in your message and attach a continuity of care document or whatever information you're sending to the provider. Within your EHR, if we're fully integrated, that compose window would be actually in your EHR, so it'd be the same type of process. Next question, does the summary have to include a CCD? Well, a CCD is a continuity of care document. And anytime we're saying clinical summary dealing with meaningful use, we are talking about a continuity of care document. And it's a very specific electronic file format. So anytime you're sending information to another provider, it does have to be a CCD. When the patient sends information from the patient portal, it has to be a CCD.
I'm going to jump in and answer. We're getting a lot of questions about the recording and presentation slides. We are recording today's presentation, and we'll be distributing that along with the slides to all registrants for today's event.
Next question is, it used to be 3 office days to provide that office visit summary. Is it now 1 business day? Yes, it is. Under stage 1, you did have 3 business days. Under MU stage 2, it is 1 business day. Next one is, if we are already giving patients a printed copy of their summary at the time of service, do we still need to send these to the patient portal? No, you don't, because you're already meeting that requirement. Because for the office visit summary, it can be paper or it can be electronic. Either is fine. But you do need to still provide them the same information that is required for that office visit summary. Next question, can you stick a direct address lookup into UpDocs? And yes, we can. We're starting to work on the provider directories now. There is a nationwide directory in the works. Expecting the requirements to be finalized toward the end of August. So later this year, we will be adding a directory that you can search across the country for anyone that's participating in the community. Next question, if we sign up with UpDocs, will we use the direct address provided by our EHR, or will UpDocs provide us with a new direct address? Well, it's actually kind of one and the same. It may come through your EHR, but it actually gets issued by us. Basically, when you register for direct messaging and do your setup, you choose what you want your direct address to be. So typically, let's say you had John at abcmedicalpractice.direct.com. Obviously, the shorter you make that, the better, because it's something you're going to be typing. And so you have full control over that. So just get together as a group and decide what you would like, what we call the domain name, which is what's to the right of the @ sign. And then just try to keep it as short as possible. Questions. Are messages sent to and from a psychologist via the UpDocs portal highly secure, as in HIPAA secure. Oh, most definitely. The information is encrypted all during the transport, requires authentication to be able to get it to the information, so there's no worries at all as far as the security.
And we are running up on time. I think we'll go ahead and grab the rest of these questions offline. In fact, I think because we have so many questions coming through, we'll go ahead and turn this into a Q&A document that we can distribute to everyone after the event, because these are definitely some great questions, and I'm sure they're not unique to your practice, so we'll definitely share the knowledge there. Thank you so much for joining us for this webinar today. Thank you, Connie, for presenting. You did a great job. Again, we'll be sending the presentation recording as well as the slides to all registrants, and you can feel free to reach out to us directly at the contact information listed right there. We do have one more webinar coming up in this series, and that topic is very much kind of what we had ended on, and that is leveraging the meaningful use requirements to maximize a CRM and grow your practice. So kind of profiting from these requirements rather than feeling the pains of them only. Feel free to join us. Again, same kind of deal. If you register and can't attend live, we'll go ahead and send the recording and presentation slides from that one as well. So thank you again so much for joining us. Have a great afternoon.